Well, in addition to being a clinician, you've done a lot of research throughout your career, and again, we're going to focus today on statins. But just big picture, what are some of the most prominent research findings you found during your career?
So, I've been at UCSF over 30 years now. And when I started, I did a lot of work on heart disease in women and whether there were different risks and benefits for all kinds of treatments for heart disease in women. And then I started getting a little more oriented towards health policy and actually did some work where that intersected and was looking at why there aren't more women included in cardiology trials, because although women make up half the population of patients with heart disease, they generally make up about 20% of the population in the clinical trials of people with heart disease. And so they're very underrepresented, and it is often hard to make definitive statements about how well treatments work in women because there just aren't enough in the clinical trials in cardiology and other medical specialties. But what I am most involved with and passionate about now is looking at our use of technology. As a cardiologist, of course, we have a lot of great technologies, but a lot of it doesn't get evaluated thoroughly before it gets onto market. And so we have some high-risk devices that don't have high quality evidence of benefit before they get approved. And so I look a lot at our regulatory system. How could we do better at both pre-market and post-market approvals? Because in the big picture, we spend a lot of money on healthcare, and my work is oriented towards having spent it on things that you get the most bang for your buck. So where people really get the benefit and where the most people get the benefit, because we have a pretty inequitable system now where some people get a lot of health care and maybe even a lot of health care they would be better off without. And then other people have very limited or no access to health care.
Yeah, one thing I've really learned from your work that I wasn't previously aware of is how differently devices are regulated compared to medications. I think a lot of Americans think that the FDA or other bodies like that are very rigorously regulating devices, but the answer, based on what you found, is that's not always the case. Is that an accurate summary?
I think you summarized it really well, Michael. I mean, when I first started looking at this, and I started actually with Sanket Dhruva, who at that time was a medical student, now is on our faculty back about 15 years ago. But I was already, well into my cardiology career, and I had no idea that these devices that I was using every day in patients had so little, and some have absolutely no clinical data before they're allowed to be used in patients. I was quite shocked, and I'm quite sure patients would be quite shocked to realize how low the bar is for most devices getting onto the market, and then how sparse our monitoring is after devices get on the market and are implanted. We don't do very well at following up on devices or on tracking safety events after approval.
Right, and ironically, devices are implanted in the body, and it requires a procedure to take it out. So these devices are things that are going to be in you unless you do a procedure. So it is quite concerning that they're not studied as well as many of us would think they would be.
Exactly.